everybody, and welcome in. It's time for another edition of WAJR's Ask the Expert, sponsored by HealthWorks, Rehab, and Fitness. I'm Tony Caridi, joined in studio by Dr. Jacob Conjeski and Mark Hose from HealthWorks, Rehab, and Fitness. And our topic today is physical therapy and joint replacements. And specifically, we'll focus today on hip replacements and knee replacements, something that is becoming just more and more common. So at some point, as we get older, chances are either you or someone that you know is going to need a joint replacement. And what we want to kind of do today is talk about the specifics of it. When is it time? And then if it in fact is time, what happens in that procedure? How's life after? Or what do you need to do maybe to prevent, or what do you need to do in advance of surgery? So guys, let's jump in. Jacob, first off, some stats here that are kind of staggering. Over 1 million people in the United States get a joint replacement every year, either the knee and the hip. My perception is, it just seems to me, is that more and more people are getting this done. Is that a fair assessment as to it's becoming more prevalent?
Yeah, I mean, that's exactly right. Now, I think we're seeing more and more of these surgeries take place, especially as the baby boomer generation ages. You know, we have an aging population in this country, and, over time, you just wear these joints out. So when you wear the cartilage off the bone and you've exhausted conservative treatments, you're kind of not left with many other options.
It seems as though the technology is changing to the point now where people bounce back from this, and it doesn't seem like it's as big of a deal as it used to be. Is that a fair assessment?
That's a fair assessment. Several reasons for that. I mean, number one, the technology, as you said, has gotten so much better over the past decade or two, and mainly that's the components that we're putting in. They're lasting longer, so patients are getting a lot longer lifespan out of their joint replacement. Also, 20 years ago, the average length of stay in the hospital was 10 days for a hip or a knee replacement. Now we're down to same-day surgery for certain patients. So it's really come along. It's not as bad as it used to be. Our pain control, especially with nerve blocks, has gotten extremely better. And I think that's really what's helped us propel to the next level and get these patients better sooner and get them back home sooner, sleeping in their own bed.
That's a mind blower. I did not realize it used to be a 10-day hospital deal, huh?
Yeah.
That's amazing.
Amazing.
It truly is. And now, as you said, I mean, people go in and people go out. Mark, let's talk about, from a physical therapy standpoint, to get to that point, what normally happens as we wear down joints? Are there things that we're doing on a day-to-day basis that may be hurting ourselves? Can you give us some pointers as to how can we prevent this or delay this as long as possible?
Some of the stuff, like Dr. Conjeski was saying, with the wear and tear, it's some of it is just your everyday life. The stuff you did from playing high school football or other sports, the type of work you do, the genetics that we got from our parents, kind of shapes and forms what our joints are like. And over time, they just start to wear. So you can see somebody who worked in the coal mines all their lives have bad knees and bad hips. The same person could be the lady who's kind of been the stay-at-home mom who's just done stuff around the house, who's also had some degenerative changes to their knees.
Dr. Conjeski, people come to your office and they say, I've got a problem. And how does it normally begin? Because not everyone that walks in that's got knee pain is going to be a knee replacement. It's normally an evolution, right, to get to that point. What normally is the beginning process when someone presents themselves?
Well, everyone comes to the office for pain. That's their chief complaint, and they want to feel better. I tell the patients it's really a ladder of therapy. So at the top of the ladder is a joint replacement, but we always start at the bottom. So the first step are things like Tylenol, Advil, just over-the-counter pain medicines. We also do things like physical therapy. We can do cortisone injections. We can do some gel injections, and we try to prolong that for as long as we can. Once all conservative measures have failed, then we talk about joint replacements.
Do you normally get some success as you climb that ladder? In other words, for some people, does ibuprofen work? Does physical therapy, do you cut off a lot of the potentials at that point?
No, I mean, I think you see success with all that stuff, but the issue is it's always temporary success. Arthritis always gets worse, never better. We just don't know how fast it's going to get worse. So if we can temporize things and slow things down with these non-operative treatments, we always start with that. But everybody's different. Some people do a cortisone shot and they last 6 months. Other people will do a shot and it lasts 6 days. So really, we want to try all that stuff, see what category people fall into, and hopefully they can keep their own knee for as long as they can.
Yeah. Obviously, this is an inflammation deal. Then if you're saying that the pills could work or cortisone can work, what you're trying to do is decrease inflammation.
Correct.
Yeah.
Correct.
From your perspective, Mark, at HealthWorks, what has normally been a process when someone does get sent over by Dr. Conjeski and they present, okay, I've got pain. How do you guys normally attack that?
So normally, once we evaluate and we kind of determine, what's going on, and we talk to the patient that they went and saw the guys over at Mountain State, and there is some degenerative changes or some knee pain. So we kind of start with the aspect of, can we get their pain under control through using modalities, doing some stretches, and start some strengthening? Because normally what happens is they're coming to us also. They have the pain, so they've been limiting themselves over time, limiting what they can do. So then we have to start using some modalities and get them back kind of moving a little bit and see if that helps start calming things down with the ibuprofen and the Tylenol or injections. Sometimes also we get them in the water too, because, when you get them in the water, they weigh less, their knees and stuff can start feeling better. And if they feel better, they can get stronger and help support that joint.
Yeah. Average age of a replacement, 65 years old, which for some is coming sooner than later. When we come back, we're going to talk about the process. What if you have to have joint replacement surgery? Is there physical therapy you can do in advance to help you after the surgery? How's it all go once that happens? We'll talk about that and more. HealthWorks Rehab and Fitness is our sponsor, and our topic today, physical therapy and joint replacements with Dr. Jacob Conjeski and Mark Hose. Do stay with us. More coming up here on Ask the Experts on WAJR.